Hi, Dan.
Hi, Barry.
How you doing?
Yeah, pretty good.
So I'm here with Dr. Dan Cohen. He's a sleep scientist, one of the foremost authorities on sleep in the nation. Tell me a little bit about how you got started with sleep.
Well, it was actually a long time ago. Um, Although I was a neurologist, I wasn't doing any work directly with sleep. But soon after, I started a business. And in 1985, we started to actually automate sleep diagnostics for sleep labs. And that was very, very early in the field of sleep. It wasn't even called sleep medicine back then. And there were only 300 labs throughout the world. So
Wow.
it was a pretty exclusive group doing interesting research.
How many labs are out there now, you guess?
Oh, I would guess probably 4,000. I mean, we were in that field for 10 years and we saw rapid growth. When we started, there were 300. When we left that field 10 years later, there were 2,000.
Wow. So that came from making it easier to do these diagnostics, or what propelled such a rapid growth?
I think there were probably a couple of factors. One was people started to recognize obstructive sleep apnea as a condition. So there was a lot more pressure to develop labs so that those people could be diagnosed and treated. The other was a technical problem that we solved, which was when they do a sleep recording, you end up with half a mile of paper. And the technician has to go page by page, and each page is 30 seconds worth of data. And they have to do an analysis on each page in terms of the stage of sleep. Are there respiratory events? Are there any cardiac arrhythmias? Are there periodic movements? Did the blood oxygen level fall?
Okay, I get it. I get it. There's a lot to figure out. So how did you make that easier?
Well, we took the output from all the measurement devices into a computer because, again, 85 was about the time where the personal computer was coming out. So now you could start automating some of this equipment. And so we automated the equipment relative to sleep recordings. So all that information came in, and then we did processing, and ultimately we did analysis. Although in the beginning, it had to be computer assisted because the different doctors and technicians didn't trust a computer to do their work.
Of course not. No. I mean, there's a lot of distrust right now over AI, so I'm sure back then there was similar distrust in computers.
Yes. I mean, we literally had to build a system. We called it CAS, Computer-Aided Sleep System, so that although they were looking at the whole night on one screen, they could move a cursor, hit a button, and then see the raw data, the raw tracing, so that they could validate that, okay, I want to put my horizontal cursor at this level and everything below it would be deep sleep, for instance.
Yeah. So you went from a mile of paper down to one computer.
Exactly. And what we were able to do is reduce the scoring time dramatically. And a number of people then started to expand by opening up other labs, having satellite units to capture the data, funneling them into a central lab and doing the analysis. And we actually had one customer who controlled 67 labs.
Oh, wow. So it's safe to say that you know a little bit about sleep.
Well, I knew it from the technical end, but as a physician, it wasn't hard to pick up what they were doing, especially during the first couple years of development, because I ended up spending many, many nights in the sleep lab, helping with the recording. And then I would work with the physicians, the next day, helping them understand how to do the analysis and how to interpret the data. So by the same token, I was learning everything they were learning or had learned to do the sleep staging. And actually, we had to set the rules accordingly. But in addition, it wasn't hard to understand what was happening with the patient in terms of the clinical situation.
So how long did it take to get you out of the mix so they didn't have to have Dan looking over their shoulder saying, hey, this is what this means?
It wasn't long. Our salespeople were able to pick it up pretty quickly, and they were able to teach the people in the lab.
Excellent. All right, so now we are here, how many years later? So that's 85, 90, 40 years later. Thanks for doing the math quickly for me. 40 years later, and what's the state of sleep compared to then now?
Well, there was such a pressure to take care of sleep apnea that the type of physicians that were doing it in the beginning, who were mainly researchers, sort of transitioned. And so there were neurologists, psychiatrists, PhDs that were, initially interested in sleep and trying to understand it. But then it transitioned to pulmonologists who were really taking care of these patients because it was an airway problem and attached to the lungs, and so they naturally took over the field, and they were less interested in the different sleep disorders that were not related, but the other people still did their work, and more people came and did research as well. So both sides of that discipline grew.
Okay, so now though, sleep apnea isn't the only thing. That seems like that was really focused on sleep apnea. But now we are aware societally there's much more attention paid to sleep. And it's not just apnea, it's just sleep in general. So do you think that that's a positive turn that we've made where people have become more aware? And as a result, what can they do about any of it?
Yeah, I mean, one of the things that happened was that, people started to see conditions that they were less familiar with. So research had to be done to start to understand what is happening here so that they could make the proper diagnosis and determine, treatments for it, at least test treatments, and ultimately, develop treatments that would be effective. So, you ended up with a broader group of patients, more diagnoses that had to be made. But along the same time scale, you had improvements in sleep apnea treatment, which has happened over the past 40 years that are significant. Everything from improvement in the airway devices to literally implants that help move the tongue and position, the muscles in the breathing apparatus so that there's less of an obstruction. But also, if you look at the past 40 years, society has changed, and there's been more stress.
Oh, yeah.
And stress and sleep are like this, and so as you have more stress, you have more problems sleeping. And so the incidence of insomnia rose, and that became a big area of treatment because it was, do you have sleep onset insomnia, sleep maintenance insomnia? And so there was much more attention paid to the sort of the neural mechanisms associated with the institution and maintenance of sleep. And that research was very, very helpful because, as it turns out, there's a fundamental issue that was researched that is still generally not well understood. And that is the most important stage of sleep, which is deep sleep. It's called delta sleep or slow wave sleep because the brain waves during deep sleep are very slow. And they're categorized as delta waves, which is, essentially from 0.5 to 3.5 cycles per second. All right.
Okay.
Then what has been learned is that over your lifetime, you lose delta sleep. And this is the most important stage of sleep. So when you start out in infancy, you've got, most of your night.
Hold on. I want to just stop you there. So you're saying that everybody, it doesn't matter who you are, you're going to lose that delta sleep?
Yeah. Oh, yeah. You need it to grow, all right, because growth hormone, 70 to 80% of growth hormone is secreted during delta sleep. Okay. And there's other factors as well in terms of cell repair, cell rejuvenation, all these kinds of things, your immune system, endocrine system. Sleep affects every aspect of the body pretty much. And so when you look at delta sleep, there's a diminution, from infancy and, but you still, in adolescence and, up to about mid-20s, you still have a nice amount. But starting in your mid-20s, it starts to decline. And by the time you reach 80, it's dramatically lower. It's almost like a ticking time bomb to death.
Okay, all right. Now, hold on a second. We're looking for some optimism here. We don't want ticking time bomb to death. We want to know how we can avoid that ticking time bomb to death.
Well, there really hasn't been much in the way of technology to do that. It's essentially you want to practice good sleep hygiene. Okay, you want to go to bed the same time every night. You want to stay in bed long enough, although most of delta sleep happens in the first half of the night. But you also want to maintain an active lifestyle. Exercise is very vital to having good delta sleep, simply because delta sleep helps restore, cells.
Yeah.
And
So, okay. So if delta sleep is restorative, then we want more of that delta. We want more restorative sleep. And you're saying right now there's really nothing out there that's a therapy for that. But there are a lot of things that are out there that are telling us we're not getting it as much as we should.
Yeah.
So I know that you are working on a product that is a therapy. However, the general populace knows only of tracking and of how bad did I do last night, or did I manage to get a halfway decent sleep last night? So with that information, is there anything that we could do right away?
Well, again, good sleep habits, good
Right.
sleep hygiene. That's probably the most important thing that can be done right away. And also remember that not everybody's the same. Okay, on average, sleep declines very substantially, and most people will have a significant decline over their lifespan, but to a variable degree.
Right. Okay. So I'm thinking about like performance athletes, right? Okay. So you hear a lot about different athletes who find tricks or nap times or schedules that they can work with to enhance their sleep. Do you think that that's an important part of performance?
Oh, absolutely. I talk to professional athletes relating to their sleep, and they really understand their bodies. They have to. I mean, these are elite athletes. So, small changes that most of us may not notice or pay attention to, they certainly do. And what I found in talking to them is how much they notice the decline in the quality of their sleep from, let's say, 25 to 35.
Okay.
Okay. Whereas most of us, frankly, think about it, Barry. Do you remember that your sleep got worse between 25 and 35?
No.
Right.
I didn't pay any attention to it.
Right.
It wasn't until I got older that I realized, okay, my sleep isn't great, but I always thought, 5 hours a night, I'm fine, because I'll just work till very, very late at night, and then I'll wake up and I'll have some coffee. And that's how I'm going to deal with sleep, is just ignore it. That doesn't help.
No, but you know what? That's how most people thought, particularly when you were 35, 45. Okay. Right. But still now, a lot of people don't understand the impact of sleep deprivation and how much sleep do they need. And there is a broad range in terms of how much sleep people need. I mean, most people need 7 to 8 hours of sleep. That doesn't mean 7 to 8 hours of time in bed. Because if you look sort of on average, most people will spend an hour of their time in bed awake or in a drowsy state. For most people, it takes a while to fall asleep.
Yeah.
Okay, they're still in bed, or they may not get out of bed right after, they wake up. And so then they look at the clock. They look at the clock when they go to sleep. They look at the clock when they wake up, and they said, "Oh, I got that amount of sleep." Well, subtract an hour.
Right. Plus, what about when you get up and you go to the bathroom in the middle of the night 3 or 5 times, and then you try to get back to sleep?
Right. I mean, deduct that.
Right. So you add all of that up, subtract that from your total time in bed, and your sleep time could be 6 hours instead of 8 hours.
Oh, yeah. Well, I mean, when you look at the degradation of sleep, particularly duration over, let's say from age of 5 to the age of 85.
Yeah.
Okay. And there have been good studies on this. And Stanford did what's called a meta-analysis, where they aggregated, all the studies that have been done,
Yeah.
so that there's a big patient population. And what they showed was that on average, from age of 5 to 85, you lose about 3 hours and 40 minutes of sleep. So you
Wait
might have slept
3 hours and 40 minutes.
Yeah. Now remember, when you're 5, you're sleeping, over 9 hours.
Oh,
But-
sure, because you get tucked into bed and somebody else is watching out and making sure you're getting your sleep.
Right. But, when you're 85, now you're down to 5+ hours. Okay. That's not good.
No.
Okay. And so your sleep is fragmented at that point. You don't have anything that resembles a normal sleep cycle. Actually, you start losing that in your late 20s. So the whole coordination of sleep, the nice cycling from being awake to moving into light sleep, then deep sleep, then up into dream sleep. Now, again, the amount of deep sleep in the beginning of the night is greater than late in the night, and the dream sleep is less in the beginning and more later, but still there's a nice cyclical pattern.
Okay.
But that goes away. That's one of the first things that disappears as delta sleep starts to diminish. All right.
Okay. So you're getting delta sleep when you're younger. There's a lot of athletes out there who are in their prime, in their mid-20s, and they're just rocking it. And then they get into their 30s and they're starting to lose an edge, right? So I'm thinking about like the World Cup, right? And I don't know if you watched any of that, but some of those performances were a total shocker. And then you find out later that they were under a rigorous schedule of moving around and with all the travel and where they had to go and out of their normal time zones. Is that going to throw off their game?
Oh, yeah. I mean, that's incredibly disruptive because most people, if they really pay attention to their sleep and want to optimize their sleep time, they want to go to bed about the same time every night. Okay. And their brain becomes adjusted to that. I mean, melatonin, which a lot of people have heard of and they take as a sleep supplement, that really works for sleep onset. Okay. Your brain puts out melatonin at a particular time, particularly if you've trained it to
now,
go
hold on. Sleep onset is falling asleep.
Yes.
Okay.
Okay. And so that aids in that. And so let's say you travel and you're 6 hours different in terms of the time zone.
Yeah.
When you start taking melatonin, it might make an adjustment of an hour a night. So you need 6 nights to get back to where you were.
Oh. And okay, so if you're traveling from another country and then you come to play a game and you're way off, you can't expect to get back into any kind of a schedule because your body's on a different schedule already.
Yeah, that will disrupt your sleep for a period of time. Now, it's not catastrophic, but these elite athletes, doing these amazing feats, they'll notice it. There's a difference.
Yeah, they have to be at the top of their game, particularly in something like the World Cup, where you're up against the best of the world.
Yeah.
And so I would say that people who are on their home turf have an advantage.
Yeah, for
they're
sure.
in their same sleep cycle, even if they're in the same time zone, they're going to be able to instantly feel like they're themselves, as opposed to someone who's traveling in from another country in another time zone who has to adjust.
Yeah, that's right.
And would that happen like in one day, or would that happen over a week? Like you said that it takes a while, but will it ever, in a situation like this where there's only so many games in like a month span of time, will they ever catch up enough to compete on their top level?
Probably not if they're traveling around that much in a month. And, when you look at sleep deprivation, there's a phrase that I think is very appropriate. It's called sleep debt.
Okay.
All right.
All right.
Like, and so if you lose like an hour one night, 3 hours the next night, you're building up sleep debt. Okay. And the
Right.
more of that you build up, the more performance degradation you're going to have.
And there's nobody who can relieve that debt for you.
No, you've got to, you got to sleep, and even, you mentioned caffeine earlier.
Yeah.
So even if you take caffeine, what's interesting about that is it will make you more alert. Okay. You can be more vigilant, due to the caffeine, but it doesn't fix the underlying issues in terms of decision making, sort of what's happening with your memory, because, the memory that's working can look at a lot of things at the same time. But when you don't get enough sleep, it shrinks. And so if you were able to pay attention and see what's happening over, let's say, 3 different areas, especially in athletics, where, hey, I got to catch this ball at the same time, who's covering me, what's the quarterback doing, so working memory shrinks. And so you're not going to be as good. Your decision making is not going to be as good. And your judgment won't be nearly as good. So all of these things come into play. And the more you have sleep debt, guess what? The worse you're going to play.
Yeah, I'm thinking of like Tom Brady. He acknowledged that sleep was really important. And I can't remember what he said about it, but I know that he thought it was like almost as important as practicing.
Yeah, he did. I mean, he ranked sleep with training and nutrition. So he was ahead of his time, understanding the need for sleep. And I think that's because he was so well attuned to his body, and he paid attention to the difference when he didn't get enough sleep. Okay. And so, he was very, very good from, again, what I've read about him in terms of maintaining a good schedule. So he would try to go to bed the same time each night, and it wasn't late. I mean, it was like, 8:30, 9 o'clock.
Yeah, right.
So he'd go to bed early, and he set aside the time to get sleep. I mean, particularly during the season, obviously.
Right.
And then he made sure he got, about 8 to 9 hours of sleep a night, which is really vital. And then he felt good. And without that, you lose some of your fine motor skills. And for a quarterback, it's one thing to have good arm strength and say, I'm going to rifle this ball to you, and
Sure.
Boom, you're going to, you better catch it. There's another thing when there's a defender in between, and you got to throw it with a nice arc so that it gets over the defender and the other, player can catch it. Well, you start losing that ability. Okay?
Because you don't have that fine motor skill that goes away, or the touch.
That's
you
right.
lose it because you're just not on your game.
Yeah, that happens, as well as, understanding quickly, what is the defense doing?
Right.
Are they in this configuration? Do I have to, watch the guy who's going to rush and try to tackle me, on over there or over here, so what's the alignment? So there's a lot of judgment and decision making that has to be made. And again, if you're not on the top of your game, you're going to miss things. And, another thing that's really interesting is you kind of lose track of error correction. So you're not recognizing that, I'm not thinking as well, or I'm not doing as well as I should be doing. And so, and caffeine, that's a real tricky one in terms of caffeine, because subjectively, because you're more alert, you're going to think everything's fine. But these underlying executive control mechanisms that the nervous system has, they're not getting better with caffeine.
Okay, so you're diminished both physically and mentally by not having proper sleep.
Well, all these things happen from the brain. So, yeah.
Wow. Okay, so I was also thinking about Roger Federer. Okay, he acknowledged that sleep was important. And where would that come into play for somebody in tennis?
Yeah. Well, from what I've read about him, he was actually quite fanatical.
Truly?
Yeah. Well, I mean, think about it. When you're in a tournament situation, you're playing very frequently. You're playing against other great athletes, and their precision is really an issue. I mean,
Oh yeah.
Every point there's a serve.
Yeah.
Okay. I mean, and they want to place it in a particular place in that box.
Yeah.
And so, minute changes will change the spin of the ball, the velocity. And so, they've got to be on top of that. So Federer, was, I don't want to say fanatical because I think it was really appropriate. So I don't want to name it.
You got to be like a machine because you've got the same size court every time. You're the person controlling the ball.
Yeah.
And so you have to get it. It's like a system. So if your system of sleep is off, your system of game is going to be off.
Right. And so during tournaments, he would spend 10 to 12 hours a day sleeping.
10 to 12 hours.
Yep.
I only know one person in my life who sleeps that much. And that's my wife. And I have never, ever seen anybody else who could do that.
Yeah. No, I've got a son like that.
Yeah. It's remarkable.
Well, and what some people do is they need that amount of time to make sure they get all of the good quality sleep. So they may be awake during some of that 10 to 12 hours, but if they're in bed that time, they'll keep falling asleep and they'll get enough of the deep sleep and the dream sleep, which really are vital to performance and normal functioning.
So you're saying that the amount of sleep could be different for each person. That is the optimal amount to sleep.
Yeah.
It's not necessarily 7.5 hours every day.
No. I mean, on average, think of it like a bell-shaped curve. Okay? So the majority are going to be in that 7 to 8 hour range. But then there's a tail on both ends. And, the tail on one end is there are some people who do just fine at 6 hours. Okay? That works for them. And then there are people who need the 10 hours.
Okay, so how do you know as a human being who's tracking your sleep and checking in the morning, on whatever device it is you decided to track your sleep on? And I acknowledge that they're not all operating at the same level versus like polysomnography, but let's just say that everything was equal. How would you know as a human being whether or not it's working? Is it just a matter of feeling?
Well, yeah. As people grew up, they sort of learned, hey, I need this amount of sleep to feel good. So forget about the trackers. It's just, hey, when I get this amount of sleep, I'm on my game. I'm feeling good. I can pay attention. I get everything that I need to get, and I'm enjoying life, and I don't need coffee, and I don't need a nap.
Right.
Okay.
Right.
But now, it's like, well, I'm going to take caffeine, and for some, I'm going to take speed.
Yeah. Right.
So they're kind of supplementing themselves, and obviously, to do that means you're not getting the amount of sleep you should get.
These things that modify your sleep are not really helping you. You got to help yourself by sleeping at the right time, by actually taking your own personal responsibility about how you schedule your day, when you fall asleep, is going to be more beneficial than popping pills or reacting with some kind of coffee.
Yeah, and making sure you're in bed long enough to get the amount of sleep you need. Because you're right. Where other chemicals can help you in terms of being alert and vigilant, and they will help to that extent. Some of these underlying functions will not be improved. And so you think you're fine because you're, awake, alert, and vigilant. But guess what? Your working memory, your decision making, your, a lot of these processes like error correction, they're not happening to the same level. And when they drop off, your performance goes down, but you may not notice at that point because you basically are making a judgment based on your level of alertness.
Okay. So back to performance for a second. Let's talk about a guy like LeBron James. He loves to support sleep publicly. He comes right out and says it's absolutely critical. So what distinguishes his sleep from someone like Tom Brady's sleep? I mean, can you compare like what skills or physical requirements might be affected differently by a different amount of sleep for each of those guys?
Yeah, well, somebody like LeBron James, in basketball, there's, a big part of it is your vertical jump, for instance.
Sure.
And guess what? Vertical jump won't change that much with a little bit of sleep deprivation. So he's lucky there. On the other hand, if he's outside the perimeter of where he can dunk the ball,
Yeah.
he's got fine motor skills to make a shot. Or if he wants to have a movement that's very abrupt or a spin, that's going to be disadvantaged. But you're right. He promotes good sleep. But if you look at him, Brady, Federer, they all say that it's the restoration that's key. And, part of their motivation was to extend their careers. I mean, look at how long these guys played versus most athletes.
Right.
And it was because, I believe, a significant part of that was because the amount of sleep they got.
And I would say back to LeBron, I mean, you got to have a mental game when you're the central figure who's sort of like everybody's sort of built what they're doing around you.
Right.
Right. So if you're off, you throw off the whole team.
Well, not only that, he's got to keep track of where everybody is to know where to look. And so, he's not that much different than an air traffic controller.
Well, that's a good point. Let's talk about that. I mean, we were talking about athletes, but just like everyday people who have to perform a function, air traffic controllers. There was that whole situation where they were overtaxed on how much time they were required to be in guiding planes in safely, and yet they were sleep deprived. Mm-hmm. I mean, what does that do to you?
No, that's a big problem. And fortunately, it's been recognized in terms of sleep deprivation, and they've constructed rules around that, which are pretty severe. I mean, you've got a shift that you can work, but 8 hours, but you can take breaks, especially when you need it. You could actually declare yourself in the middle of a shift as unfit for duty.
Oh, I didn't know that.
Yeah. And then they get assigned a different job that doesn't require the decision making that's required to, make sure this plane can land at this runway, et cetera.
Right.
But again, if they're not on their game, there's critical issues at hand.
Oh, incredibly critical issues. And so it's not just, is it just them who has to make that call, or is there something else in the system that says, hey, this person, can they track that and say, hey, you haven't been on long enough, or you've been on too long? Did you know anything about that?
Well, I know that, it's very rigid for the most part in terms of, their length of time, that they can be on in terms of the actual duty of, controlling aircraft.
Right.
There are mandates related to how much sleep you should get, before your shift.
Right.
How much time off you need, particularly, and it's different, related to a nighttime shift versus a daytime shift. Because again, you're off your schedule.
Oh, yeah, sure.
Okay, so they need more time, and then they need more recovery time after. So built into these schedules. But I'm not aware as to whether or not there's any regulation regarding monitoring.
Okay. Right.
It would be nice if there was, because now there's the ability to do that.
Right.
To say, hey, when you come to work, show me your recording, show me your sleep time from last night.
Right. Well, I mean, think about things like eye strain, though, right? If you're sleep deprived in any way whatsoever, your eyes are going to suffer throughout the day, and it's going to be harder to look at little screens and figure out where people are coming in.
Yeah, well, fortunately, I think they've got equipment right now that their screens are nicely sized, and there's a lot of software that they have that allows them to track just what they need to track, and there are alerts because a lot of this stuff is automated to some extent. So there are some safeguards built in that make it easier to track a lot of incoming traffic and outbound traffic.
Yeah, that makes a lot of sense, just purely from the technological sophistication that we keep improving all of that. But at the same time, if we're oblivious to the fact that humans have this frailty, let's call it, or potential frailty from not getting enough sleep, there's only so much that technology can help them. If there's a warning going off and they're nodding off, they're going to miss it. So I think the fact that we've changed the way we look at sleep. I mean, think about doctors. You're a doctor. You were an intern. You probably had grueling hours.
Yeah, it's funny because I didn't realize, how much change has occurred, in the regulations regarding that. I thought that, everybody was still doing what I had to do.
Well, give me an idea of what you had to do and how it's different now.
Well, we typically, starting in your third year of medical school, so it's the third year of medical school, fourth year internship, and typically the first couple years of your residency. So you're talking about, probably 4 to 5 years of having to be what they called on call. Okay. So you would come in the morning when you had one of your on call days, which were typically every 3 to 4 nights.
Oh,
okay. And you would work all day. You would be there all night. And depending what the workload was, maybe you could catch some sleep. Okay.
In the hospital?
Yeah. Yeah. You were there for 36 hours. So you were there, all day, all night, and the next day. Okay.
No,
so they were 36-hour shifts, and you'd have them every 3 to 4 days.
And you're just supposed to tough that out.
Well, back when I went, which was a long time ago, yeah. I mean, you didn't know any different, but we didn't know that much about sleep either.
Right.
So it turns out, I was aware, there was a little bit of an uproar, when I was doing all the work I was doing in sleep. There was this case that happened in the mid 80s. Okay. Where this woman died, and it was clear that it was due to an error that was made due to sleep deprivation by one of the docs. And it turned out that her father was a journalist and a lawyer. so there was a court case, and obviously, the jury found, the defendant guilty of. I don't remember if that person was charged with murder, but there was. It became very clear in New York that the rules had to change, and they were the first one to make the change. They made it in 1989. So I was familiar with that because of my involvement with sleep. But it took a number of years before regulations changed nationwide. I mean, I think the regulations became nationalized in about 2003.
So really not that long ago, if you think about it, it took, almost 20 years to nationalize it from something that they clearly proved was important in New York in, 1989. So that it takes society a while to kind of catch up to what we're learning in general.
Well, and that's because, the docs that were sort of older and had gone through it would say, hey, you know what? I did it. Why can't you?
Right. Right.
Plus, there's economics involved.
You bring up something that's societally really intriguing to me, is that we grew up with the whole mentality of just tough it out about everything.
Yeah.
Everything. And it doesn't matter what it was. You got a problem. Don't
Deal with
let
it.
it show. Deal
Right.
with it.
Yeah.
And now there's a lot more understanding that we're actually human, and that there are some things that are built into us that are different depending on who you are. Some people are more capable of toughing it out,
Yeah.
and that's great for them. But for those who
let me
can't,
let me interrupt you.
sure.
I mean, because you talk about this issue of doctors in the hospitals. The guidelines right now are that there's a 24-hour shift every X number of nights. So and if you're busy that night, you've gone 24 hours without sleep.
Even now.
Yeah, even now.
Okay.
Okay, and let me equate that with something that everybody knows, and that's blood alcohol levels. Okay, blood alcohol concentrations. When you've gone 24 hours without sleep, that's the equivalent of a blood alcohol concentration of 0.10, which is above the legal limit in every country in the world.
Really?
Well, the highest levels are 0.08. All right,
Yeah.
and that's only in the U.S., Scotland. No, it's not Scotland. I think it's 0.05, but the rest of the UK is 0.08. Singapore as well.
Okay.
So those are the only countries that sit at 0.08. Everybody else is lower. The rest of Europe is 0.05. Some Scandinavia is 0.02. Okay.
So for everybody who's not doing the math, 0.1 whatever you said is higher than all of those.
Yeah, it's higher than all of those, and you're functioning neurologically at the equivalent of that blood alcohol concentration when you haven't slept 24 hours.
So basically, they talk about doctors who drink. They don't even have to drink to have their blood alcohol level thrown off simply because of their work schedule.
Right. And when they get to the end of that schedule, they are not functioning normally.
Okay, so if you were like a truck driver and you're trying to just tough it out and keep going, you're basically drunk driving at a certain level.
Yeah, I mean, I don't know what the incidence of driving accidents is regarding, drowsy driving.
Right.
But it may be the biggest sleep problem that exists in terms of fatality.
Because nobody knows that person was sleepy.
Well, right. I mean,
and they're not checking their blood alcohol levels,
right,
for sleep.
Well, no, exactly. There is no monitor for that.
Right.
Okay. So again, nobody knows. But if you're pushing it, then caffeine will get you so far, but still there'll be judgment errors.
Right.
Okay. So that's sort of a short-term fix that may not be perfect. All right, for that individual. And so, you run the risk of big-time problems.
Yeah, I'm just thinking about all the people who are driving all day now because they need another job and they're out dashing or, whatever they're, Uber. There's so many more people now who are taking jobs in their car, driving all day. And some of us are jumping in, getting a ride back from the airport. We have no idea how long that person's been awake.
Right. I don't know if there are any requirements for them to only work X number of hours. There may be, for all I know, but if there aren't, then you're right.
We have no way of looking into that, and they have no way of knowing that their own sleep deprivation could just suddenly creep up on them and make them incapable.
Well, they're probably unaware of what we're talking about right now.
Absolutely. And so the more and more we become aware, maybe the more we can impose certain restrictions and try to make things a little bit safer overall when it comes to sleep and performance in every aspect of life.
Oh, yeah. Oh, absolutely. I mean, people really need their sleep. And, people talk to me all the time about longevity, and they say, do you want to be healthy so that you can live longer? And, I basically tell them, I want to be healthy for as long as I live.
That's a different thing.
That's a different thing.
Right.
I figure I'm going to die when I die. I just want to be healthy. I mean, I go back to my father. He was healthy his whole life. He died overnight with a stroke when he was almost 93. As far as I'm concerned, that would be great for me. I mean, we're all going to die, but if you're healthy all that time, terrific. Because so many people these days are, they're sick for the last, 5, 10, 20 years of their lives.
Right. So they're getting to those illnesses partially because they're not getting that deep sleep you were talking about earlier.
Oh, yeah. I mean, if you correlate the loss of deep sleep with the incidence of chronic illness, there's a perfect inverse correlation. In other words, if you've lost most of your deep sleep, the chances are exceedingly high that you're going to have 2 or more chronic illnesses.
Oh, so basically what we need to do is to make sure that we keep our deep sleep. And we should probably go into deep sleep a little bit further, a little bit deeper. But let's do that next time we're together and really dive into the aspects of deep sleep, REM sleep, the different stages of sleep, because all of those have different interesting components that I'm sure people are going to love to hear about.
Yeah, as well as the sort of the criteria for some of them, because there's some issues there that I think if we looked at them differently could be more helpful.
Excellent. Is there anything you can leave us with that would be your gold standard? Everybody should do this no matter who they are when it comes to sleep.
Yeah, I heard somebody say the other day that lack of activity is, particularly as you get older, is the new smoking. And I couldn't agree more. I mean, people need to be more active. And these days with computers and games and, especially with all the different channels and watching this and that, people are generally more sedentary. And, that activity is vital. You'll feel better. It in and of itself causes you to be more alert.
Right.
When you stop exercising, and you're going to sleep better. So I would say get off the couch, more activity.
Get off the couch. Put that cell phone down. Get out. Forget your mobile device. Go play. Run around. Enjoy nature.
Exactly.
All right. Thank you.
You're welcome.